technique. Now, what I suggest we do is bring the foot of a top leg and place it in the crease of a knee of a bottom leg, and the bottom leg is in a little bit of flexion, and that's it, done. Yeah, no problem. You might read in certain books, depending on what level you want to manipulate, L5 or 4 or 3 or 2 or 1, they might say we change the position of the leg, yeah, around here. But I think to start learning, yeah, just adopt the foot in the crease of a knee, and that will suffice you for 99% of manipulations for the lumbar. The second thing we do, don't do it, yeah, hand on the waist as a counterbalance. Now, everyone wants to help, don't do it. What we're going to do, let's say for instance, depends what level we want to manipulate. Let's say we want to do 5 on 1 or 4 on 5 or 3 on 4. Whichever level you want to do, you palpate the level above. Okay, so you flex them down to the level, but not past the level. So if you want to manipulate, say L4, 5, you'll rotate it down to 3, 4. So you don't over rotate and lock. Okay, it's just increase in tension. Okay, it's like when you feel the chest door, you feel the bind, but you don't pull where it's starting to fall back in you, yeah? All right, so it's just where you feel the bind, stop, where you feel the resistance, stop. So what we're going to do, let's say it's 4, 5. So L4 is in line with the iliac crest, yeah, where my finger is in here. So I'm going to go to L3. Now watch the way I do it. So I'm going to hold the upper arm, and I'm going to slowly pull her down to the level, as in where my finger is in here. Try not to over rotate. No, and I probably would bring the neck into neutral, so she's looking up. So the hand is on the wrist. So this is like the main sort of setup position here. And then you think, well, what do we do now? Yeah, so this would be like part 1. Happy with that? Yeah. Now part 2. Now if I'm going to say anything, this is what I say it. If you send me the video, I'll say to you, thanks for the video. Yeah, but you forgot the 3 things. Yeah, the advice I gave you, and be like, what was the 3 things? Exactly, because you forgot. Yeah, and that's the 3 things coming up now. Okay, so the first thing is that we would roll the patient as far as we can, as if they're almost going to fall off. Roll as if they're going to fall. Okay, number 1. I'll show you in a second. Number 2, you as the patient or therapist is going to get your body weight up and over. Number 2. And then the mobilization of a thrust is going to go through her femur. Okay, number 3. If you remember those 3 things, you'll do okay. If you remember 1 or 1 and a bit, nothing's really going to happen for you. You always have to remember the 3. So from this position, so number 1, your hand is through this space in here, okay? So come on to the level, say 4. So I'm going to roll my patient. It's easy in this case with this patient, okay? Watch now, okay? I'm going to roll her. Some people will click just when it's rolling. Okay, so I'm going to roll as if she's going to fall. Later on, now I'm not going to show you now. Don't do it after. So roll as if she's going to fall. Now from there, technique number 2, get you a body weight, watch. There we go. Up and over, you see? Up and over, and it just went click right under my thumb, just in here. It's a shame really. But it's good in some ways because it went, yeah, but not good for the manip because it's already went. Okay, so it depends on how you look at that. But I think from a bonus perspective, it's good because I'm focusing on where my thumb was. It went click, click under my thumb. Perfect. Okay, so my body weight is up and over. So watch now. Okay, so my movement, look. So my body weight is going to go through her femur in a side bending thrust rather than a rotation thrust. Most people want to manipulate. Will do all sorts of things, and most of the time they'll do this. They'll do this with their elbow.
Oh, yeah.
Okay, they don't like it. Yeah. Okay, so any pressure here, they don't like any of it. Okay? And a lot of people end up doing this, and they go. Okay, click just by doing that, but it's non-specific. You're just hoping for a click. Yeah. So what you want to try and do is rotate to the level, and then fine tune at the position. So from here, okay, so I've rolled as if she's going to fall. My patient would never be there this long, all right? So your body weight is up and over, and your weight is going through the flatness of the forearm. So my body weight is dropping through my arm. So these are together. They're not separate. This flatness here, so it's comfortable for them. Not there. She won't like it. Some of you won't like it now, I can guarantee. Yeah, because of the way it's been done on you. So your body weight is up and over, and then from there simply mobilize, you see, I'm mobilizing through. If I wanted to, I can use the knee to continue the mobilization. And I can also use my knee called a kickstart. This is more tomorrow. Okay, and I can mobilize it through here. Will it cavitate? I don't think it will because it's already cavitated. If I wanted to lean on her, let me just lean, you can just lean a little bit. Okay, I'm not going to force because it's already gone. So from there, take a small breath. So the thrust would be you drop down from there and the body weight dropping down, thrust through. Okay, and it's just drop. Yeah, that's what I mean. So if it hadn't clicked, it would have. But because it clicked setting up, it's not going to click on the thrust. Yeah.